Hello and good afternoon. My name is Carla D'Imperio, and I am the Director of Family Support for the Phelan-McDermid Syndrome Foundation. I'm also mom to Matthew, who is my 10-year-old son who has Phelan-McDermid syndrome, and I'm very happy to welcome you to our final Pathways Education Series webinar of 2025. Today, we are going to be talking about our resources. So I'm really looking forward to giving you a tour of the resources that PMSF has available to our families, and then show you some of our new resources that were just recently published and shared. So that is what we will do together today. So let's go ahead and get started. I'm going to start by sharing my screen. And like I mentioned, I really want to take the opportunity that I always love showing families everything that the Phelan-McDermid Syndrome Foundation has to support you as you take this journey with your child who has this very rare diagnosis. So our homepage, you can see that we do put some updates on here. So we have our Giving Tuesday update. We had a really successful Giving Tuesday campaign, which is exciting. Almost $80,000 raised in just one day. Amazing. And if you scroll down on our homepage at any given time, you're going to find our latest blog posts. They will always be down here. PMSF Now is our blog, and a lot of the updates and things that we share on social media or in our newsletter, you'll also find here on our blog. So you can see even just in the last week, we have 3 blog posts. Yesterday, we announced Neuron's phase 3 trial for NNZ 2591. Then there's an update on the natural history study that was from a couple days ago. And then last week, you can see that we announced our new CEO, Robbie Baker, who will be joining us in January. And we're very, very, very excited about that. So again, any news updates, anything that's featured on our blog, you'll find right here at the bottom of our homepage. So I'm going to scroll back up. Just want to familiarize you with what's available on the homepage. We always have our join and donate buttons. So if you're not a member of our foundation, it's free to join. And that means that you would be added to our newsletter mailing list. And you also, if you're a parent or a caregiver of a child or adult with Phelan-McDermid syndrome, that individual would then be counted amongst the population in the world of individuals diagnosed with Phelan-McDermid syndrome. We're almost at 4,000 people in our membership, individuals with Phelan-McDermid syndrome in our membership worldwide, and about half of those are in the United States. Our donate button is always up here, and all of our family support programs, with the exception of our family conference and everything that we offer to our families is at no cost to our families. Our membership is free for families. So we rely on our donor dollars to be able to keep all of our amazing programs, all of the work we do on science and research, all of that going. So we welcome any donations or sharing that along with others in your network is always greatly appreciated as well. Okay, so you can see on our top banner here that it's kind of broken out by our 3 pillars. So the Phelan-McDermid Syndrome Foundation has a mission of making today better and the future brighter for individuals living with Phelan-McDermid syndrome from the moment of diagnosis through the delivery of treatments and cures. And in terms of helping our families now, dealing with supporting, the symptoms and all of the challenges that you're going through, and also working towards the future when there will be treatments and cures for Phelan-McDermid syndrome. So we have a lot of important work happening in all of those areas. And the mission then is broken out into these 3 pillars: connect, care, and cure. And if you're going to our conference this summer, or if you went to the conference in 2024, you'll sort of see that language in our agenda. And it's something that we use on social media. When we post, you might see connect, care, and cure as the different areas of focus. So that relates back to our mission and who we are and the work that we do. Connect is family support. So everything to do with family support is going to be under here. That means really supporting our families with the challenges they're coping with, our caregiver support group program, our regional reps throughout the country, all of those pieces, getting families together for the conference, that's all family support. That's under the Connect piece of our mission. So you'll see the conferences here, et cetera. CARE is the part of our mission to do with improving clinical care for our population of people living with Phelan-McDermid syndrome. So that means helping with the symptoms you're dealing with today, right? So neuropsychiatric illness and regression, loss of skills, epilepsy and seizures, gastrointestinal, all of those symptoms of Phelan-McDermid syndrome, the support that we can offer, the resources we offer, all of that is under the care piece of our mission. So that's here. And then, of course, our cure piece of our mission is to do with science and research initiatives and pursuing treatments and cures for the future, which, there's just so much momentum happening right now in that area. We'll talk about some of that, but that's how the pillars are broken down. My work as the director of family support is really in the connect piece of the mission and care. So that's where I'm really going to be able to talk and relate to you all the most. And then when we get into cure, if you have questions that I can't answer, or if there's more information that you are seeking, our Chief Science Officer, Lauren Schmidt, is the person that would be able to best support you in any additional information you need. Okay, so let's start with some of our connect pieces of what we have available to help our families. So this is going to show you our support programs. One that I really want to highlight for you is our caregiver support groups. We have monthly support groups for our parents, guardians, and primary caregivers of individuals with Phelan-McDermid syndrome. These meet every month. There's 4 groups per month. And if you go to this page on our website, you'll always be able to see the latest menu of offerings in terms of group meetings, as well as the registration links for those meetings. So you'll see that we've already had these 2 groups meet this month. The dad's group met, really well attended. It was a great group. And then our general group for caregivers of individuals ages 18 and up, that one just met on Sunday afternoon. Just on this coming Thursday, so 2 days from now, our neuropsych group will meet. So that's for our families who are dealing with neuropsychiatric illness, which is, a very challenging way that Phelan-McDermid syndrome can manifest itself is through these episodes of neuropsychiatric illness. And so we have a special support group just for the families, caregivers, guardians going through that. It's a very well-attended group. It's been really nice to see that community kind of come together every month and support one another in a challenging time. And then our other general group meets also on Thursday. That's for caregivers of children from birth to age 18. So we break the general group out by age to give it a little bit, a little more consistency of the people that are attending. In 2026, we're going to be offering some new group topics. So we'll continue with our dad's group. We have our group for newly diagnosed families that meets every couple months. And then we're going to be adding in a group for adult siblings. That will be a new group that people have asked for. So a support group for adult siblings of individuals with Phelan-McDermid syndrome. So I'm really excited about that group coming. And if you go down, you'll see the registration links. They're all on Zoom and they are facilitated by either Kylie Richards, who's a licensed independent social worker. She does our general groups. And then Dr. Al Friedman, who is a clinical psychologist. He does the specialized groups. So those 2 facilitators have been facilitating these support groups for almost 3 years. We're coming up on 3 years, which is really amazing. And the one I did not mention that also will be meeting in January is our grief group for our families who have lost a child. So it's a place for them to come together and support one another. These are all support groups, so it's not one-on-one therapy. It's not a place to ask medical questions or get medical advice. It's a place for parents to come together and talk to others who understand and can support each other, because living with a Phelan-McDermid syndrome diagnosis, losing a child, all of these things are very, very challenging. And so we need to support one another. So that's our support groups. Again, that was under our Connect pillar. One thing that I want to highlight too is we have our conference page. So our conference registration is coming soon. I'm one of the co-chairs of the 2026 family conference. I'm really, really excited to see those of you that are attending in Denver. Um, and as we update, have more information available, we will be updating this page on our site. So there's the program at a glance. It shows you how our conference is broken down kind of into the tracks of Connect, Care, Cure, like I just mentioned. Registration information, again, coming soon. Information about the hotel. So all of this is here. I would encourage you to explore. And if you're coming, if you're planning to come, take a look through. I'm really excited to share. We have a whole funding guide that we've put together for our families to help you with getting funding through different organizations and different, there's um, different groups that can provide funding. So there's all of this is information about, there's organizations that can help. There's all kinds of information, state specific organizations. And then this is the guide to preparing your application, which even includes a sample budget, um, a sample letter, all of that. So you can use all of these resources to help you with getting some funding to help alleviate the cost of the conference for your family. Um, So that's our conference page. I would, check up on that, keep updated on it because more information is added regularly. I also want to show you our Wall of Remembrance. This is new this year, so this is a beautiful page on our site, really to honor and pay tribute to those who have passed away. So we, if you, want to visit the page and read about some of the beautiful adults and children who we have lost, along with lovely quotes from their families, that is here. And this is something that we just started over this past summer. If you have a loved one who passed away, you can add their details as well. All right. So those are some of the pieces under our Connect family support piece of our mission. And what I really want to spend the most time on, because it's where we offer the most robust resources and also where you're going to be able to take these things and use them to really hopefully improve your child's care. So I want to spend the most time under the care part of our um, site. It starts with our What is Phelan-McDermid syndrome page. So this is a good page to send people to, family members if they have questions about your child's diagnosis. Um, there's some background on the genetics and what all of it means, the numbers and Shank 3, all that stuff. So that's all here under the What is Phelan-McDermid syndrome and then how it's diagnosed. I'm not going to get into the genetics piece today, but there is a lot there. And if you have questions about your child's genetic report, um, or their genetics in general, you don't know what that means or what the next step should be, then let me know. Email me at carla@pmsf.org and I can get you set up with our wonderful genetic counselor, Tess Levy, who she consults with one of our families per week, and that is at no cost to our families. So we can get you set up to meet with her for a genetic counseling appointment. That's one of our referral programs. Okay, so medical issues and clinical care. This is really where the bulk of our care family support resources live. So I'm going to spend a lot of time in here. So let me give you an overview of the page. The top, we have our medical advisories. So we have a wonderful medical advisory committee who occasionally will issue a statement which gives medical information specific to people diagnosed with Phelan-McDermid syndrome. And so we catalog those and keep them here. And I will get into some of that in a little while. Our medical issues, these are just the different kinds of medical issues and physical features our individuals can have. So if I look at seizures, it gives you a little information about what that means. These all have drop downs. And then the references for these pages is all down here. What I want to start with, though, is our clinical consensus guidelines. So we are very fortunate to have two really new from 2023 sets of guidelines that have been put together by experts throughout the world. So there's one set of guidelines, the European Clinical Care Guidelines. This was put together by a team of experts in Europe. Um, it's representing 15 countries and more than 70 clinicians, scientists, and patient advocacy representatives. And the full guidelines covers a lot of different topics, and they're all broken down here. So the European guidelines are broken out by topic. You'll see there is a synopsis of all of them, which I will open in a moment. I just want to kind of give you an overview first. And then it breaks them all down by topic here. Okay. We are going to go through all of these resources through the lens of someone who is looking for support with their loved one's sleep. You may use these resources in the same way to help you with any of your loved one's symptoms related to Phelan-McDermid syndrome. And I think sleep is good too because it's a pretty universal problem with our population, right? Most people who have a child or adult with Phelan-McDermid syndrome deal with or have dealt with or will deal with sleep disturbance. So we'll do that one. Okay, so that was our European guidelines. Now this is our second set of guidelines that was also published in 2023. So a little confusing because it's two different things, both published the same year. But if you look at them side by side, they really say a lot of the same things. So that's kind of what I want to show you when we get into the looking at the sleep disturbance. This set was published by a different group of clinical experts and representatives from the parent community. And it is not broken down by topic in separate documents the way the other one was. This one is all synthesized into one very large, more than 30-page document. So it's a little bit different, but a lot of the same type of information. And both of these sets of guidelines use the same studies and the same pull from the same research information. That's what informs the guidelines. Okay. So let me open this one and show you. The other one I showed you was broken down by topic. And this one is one big document where you've got to scroll through 30 pages and find the topic that you're looking for. All right. Um, Everything with Phelan-McDermid syndrome, when we read things like this, they're going to start with genetics because it is a genetic disorder. So that's where it's going to start. And then that genetic disorder is what causes all of the neurological issues. So usually they'll talk about neurology second. Um, so it's talking about genetics. Here's our recommendations pertaining to genetics. So all of the topics that they discuss, each of the sections is going to have a recommendations table pertaining to that section. All right. This is a little breakdown about genetics, neurology. See, there it is, second. This talks about recommendations pertaining to neurological conditions. So neuroimaging abnormalities, epilepsy and EEG, and it gives you recommendations pertaining to those. So this is really, really important. This is the type of thing you would want to share with your child's medical professional. If you're seeing a neurologist, you want to make sure they see this chart and read the section about neurology. Okay. There are special indicators here for ring chromosomes. So if your child has a terminal deletion, they may have a ring chromosome. They should have a karyotype test to see if that's the case. If they do have that ring chromosome, you want to follow these considerations involving screening and surveillance, mostly to do with MRI, in addition to all of the other considerations. So keep going through epilepsy, seizures, neurodevelopment. Again, it's showing you a recommendations table for each topic. And eventually we will get to sleep. So that's what we talked about. It's going to give you kind of an overview about sleep disturbance. It's common with a prevalence from 24 to 75%. So that's going to depend on which study you look at. And they're pulling this information from studies which are cited here. They encompass difficulty falling asleep, frequent night awakenings, reduced total sleep time. So there can be different ways that sleep disturbance can manifest. And then it gives you your recommendations table. So sleep hygiene techniques are the mainstay of improving sleep. So anytime you're talking about sleep with a medical professional, they're going to want to start with sleep hygiene. That includes things like bedtime routines, reducing stimulating activities, reducing ambient light and noise, And then if those types of things don't work and you rule out medical conditions that may be causing pain or maybe causing other restless leg, all of that, then you would be at the point where the doctor might consider medications for supporting sleep. So it talks about commonly prescribed medications include melatonin, um, and continues through some different medications and gives you some references related to those. And then it just does discuss restless leg, et cetera. So you can see that this is kind of a narrative recommendation for sleep. And then here under the recommendations table, this part is challenging behavior, but the part we want to look at for sleep is this section, sleep. And it gives you two columns. One is behavioral interventions, the other is pharmacological interventions. So we have the behavioral interventions here. And usually that the doctor, if you're seeing a sleep doctor, a sleep specialist, in our case, my son sees sleep neurology, they're going to want you to do all this stuff first, before they'll consider pharmacological support. I mean, that's not always, but most times they might want you to do a sleep journal and look at it for a month and see are there patterns, all of that type of thing. So I would just be prepared for that if you're dealing with sleep challenges. Um, they might want to do a sleep study and see if there's apnea and rule all of that out. So it could take a little while, to figure out and to get the right intervention for sleep. Okay, so that was sleep within the framework of this US International Consensus Guidelines, the 30-page document. So we looked at the little section about sleep. Just keep that in your brain. I'm going to just go show you the rest of this. There's a lot more here. So we get into regression. We get into a whole section about GI, including rumination, nutritional deficiencies. Then we get into primary care, um, physiatry. So there's a lot here. There's a lot of different information, nephrology, urology, and each of these sections, again, has a recommendations table. So you can look at, and sort that's like the synthesis of the section, and that would be the main takeaway to give the doctor. If you go to the endocrinologist, you would want to make sure to show them the table for endocrine considerations in Phelan-McDermid syndrome. If you go to the gastroenterologist, you would want to show them that section. Okay. If you're there, here's a whole section on gynecology. So there's dentistry, all kinds of stuff. This is our definitions of commonly used genetics terms. So that's a lot of information that was in words that maybe were in the guidelines further up. It gives you a bit of an explanation. And then conclusions. And finally, there's all the citations and acknowledgments of who contributed all the references. Okay, so that is the US international guidelines. That is one 30-page document. I would print this and have it, and you can take it with you when you take your child to different specialists. They can photocopy it. They can look at the pages with you. Or you could upload it into your child's portal and attach it, in my chart or whatever portal you use, you can upload the document. So that you want to make sure that this is something that you know how to access, and that you're able to provide to medical professionals when they might need it. And then up here, we're going back up to the European guidelines. So I'm going to click on the synopsis first. The synopsis is the overview of all the guidelines. And like I mentioned, it's going to start. This is actually pretty interesting. This is like a page that tells you the kind of the symptom and how prevalent it was based on particular studies. So interesting. But anyway, it's going to start with genetics. Like I mentioned, they usually start with genetics. Here it talks about ring chromosome, and then it's going to kind of go through all of the other synthesis of all of the other guidelines that I'll show you. So this is the synopsis of all of the European guidelines. If we go down, you'll see here's the section on sleep. So that's what we're going to be digging into more again, is sleep. All right, so if I go back and go down, Here is European consensus recommendations on sleep. So let's go into it. And if I open it up, I'm going to get a long 9-page document all about sleep in Phelan-McDermid syndrome. Let's zoom in a little so we can see what we're talking about. But at the end of the day, the takeaways from this are going to be very similar from the takeaways that I just showed you in the other consensus guidelines. Sleep hygiene, ruling out medical issues, then considering pharmacological interventions. Generally what it's going to say. So there's an introduction, talks about the different studies that are being looked at. You know, y'all are welcome to peruse these and look at them in detail. Gets into the methods of the studies, reviewing the literature, so we talked about prevalence and types of sleep problems in the other guidelines, remember, but this is just a little bit more detailed. This gets into some of the prevalence and gives you the percentage of people affected with these different issues at different ages. So kind of cool. Um, keep going. Talks about sleep and other co-occurring conditions like reflux, diabetes, asthma. So those are the things, if your child isn't sleeping or your adult isn't sleeping, they would want to rule some of that stuff out and make sure that wasn't the reason why. Are they not sleeping because they're having reflux and it hurts and it's burning? Okay, well that maybe is an easier problem to solve. Um, all right, so then if we get through all of that, it's going to get us to our recommendations table eventually. Here we go. So that's conclusions. Here's our recommendations. So just like the other guidelines had a recommendations table, so do the European guidelines. They have a recommendations table. So this is like the main takeaway that you would want to make sure you're sharing with your child's medical professional. Every individual should be evaluated for somatic, environmental, neuropsychiatric causes if they have sleep problems. Mental health conditions need to be investigated and treated. In individuals with PMS with sleep problems, sleep hygiene should be evaluated. So this is a lot of what I mentioned, right? We're talking about ruling out medical and psychiatric issues, making sure the sleep hygiene is good. And then if sleep problems persist despite all of these other appropriate interventions, the individual with Phelan-McDermid syndrome should be referred to a specialist experienced in sleep problems or a specialist sleep center. And that would be where potentially medication could be prescribed. So that's the most important part is the conclusions here and then the recommendations table. Okay. So I'm going to close that one out. So again, holding that somewhere in your mind, we've looked at our U.S. International Consensus Guidelines it was the 30-page document. We looked at the sleep part. Then we looked at the European guidelines document just about sleep. We can see that they are similar, giving similar recommendations and conclusions. And let me go back. And I want to just tie up the sleep bit so you can kind of see how you might use all of our resources, right? That's kind of the point of this. So if you're going to the sleep specialist, you've already shown them the 30-page document. Now you show them the European consensus recommendations on sleep that we just looked at. So you can show them those two resources that will help guide the care. And now, say you've done all of the sleep hygiene, all of the, you've ruled out the medical issues, and you're like, we're really desperate here. We need some help. So, under our care tab, and I will send you all these links. If you go to our neuropsychiatric consultation group and scroll down, we have a whole document of recommendations for pharmacological management in Phelan-McDermid syndrome. So this is going to have pharmacological recommendations, meaning medication recommendations regarding these different diagnoses. So if they have Phelan-McDermid syndrome and either ADHD, sleep disturbance, irritability and aggression, mood cycling, catatonia. Okay, so I'm going to open this one up and you can see what I'm talking about. It's a lot to look at. It's not though. It's okay. We're going to walk through it together. So each page of this document has flowcharts pertaining to the symptoms or diagnoses underlined at the top. Okay, so if your child or adult has Attention deficit hyperactivity or impulsivity, this would be the page to help guide the pharmacological choices you're making with your child's medical professional. Okay, so it's one piece of that decision making process. Page 2 is irritability, aggression, self-injury. Page 3 is anxiety. If your child has an anxiety diagnosis, in addition to Phelan-McDermid syndrome, this is the page you would want to share with the psychiatrist and talk through with them as you make decisions about the medication. Um, excuse me. Page 4 is catatonia. Catatonia has several pages after of considerable detail and more information. So there's another page. If your child is dealing with a neuropsychiatric episode involving catatonia, anything severe neuropsychiatric, reach out to me, and we have a lot of programs and support we can offer, which I will talk about a little bit soon, a little bit later, I mean. But don't try to go that one alone. We have a lot to support you. Don't go any of them alone, though. Sleep, any of it. We are here to walk through all of this with you. Um, Mood cycling also has another page to kind of give more context. And then last but not least, here is sleep. So again, we're looking at everything through the lens of sleep. So if you've gone through, we went through the US international guidelines, we looked at the European guidelines. Now we're going to look at the pharmacological recommendations. So you have these three different resources that you can share with your child's doctor regarding sleep. All right. Um, So all of these have a top section above the dotted line, which is kind of the clinical assessment, and trying to figure out if the sleep hygiene is done right, is there an underlying problem, and is there something else at play? And if the answer to that is no, there's not, we solved all of those issues, none of that is at play, then yes, we will go on to the bottom section, which includes the pharmacological management. All right. So again, it's starting with assess and implement adequate sleep hygiene. Is there ambient light? Is there white noise? Are there bedtime routines? Is the child using electronics before bed? All of that. Um, if the answer is no, all of that is fine, then they're going to do a diagnostic assessment of all of these medical issues. We want to rule out if there's some kind of pain, dental, epilepsy. If the answer to all of that is no, is there restless leg syndrome? They would probably want to try iron. If that helps, great. If not, are there psychiatric causes? So if the answer to all of these things is no, those aren't the issues at play, then you would be going on down the flow chart. You're not seeing improvement in the sleep, so you're going down the flow chart to the pharmacologic considerations, starting with melatonin. If there's a partial response or non-response, increase up to 10 milligrams. And then if there is no response, you would move on to the next step, clonidine, trazodone, or magnesium glycinate. Now, your child's doctor might say, okay, well, I have another idea, and that's fine. You guys need to work together and make the decisions. This is not medical advice. This is a guideline. This is to help you on your, decision making, but it's not to say it has to be this order, it has to be this way. This is just one piece of information that you can use alongside whatever resources your child's doctor has to make decisions about managing your child's care. Okay. So for my son right now, he's on trazodone. We're kind of at the max dose for his weight. So at that point, we would be considering if we need to move up, to the next step. He's been on clonidine for sleep in the past for several years, so maybe we would want to go back and try clonidine again. I would ask the sleep neurologist because we trust him and he knows Matthew and he's also familiar with these resources. So, that would be a conversation that we would have at that time. Okay, so I just wanted you to see how all of the resources kind of work together. So if you look at this page about sleep, it goes back to and it is kind of echoed in the guidelines that we looked at, right? They had those recommendations tables and they all kind of say the same thing. So When you go to your child's specialists, you have these different resources that you can take. You don't have to print them if you don't want to. You can take them, virtually, take your phone along and show them, or you can print them and bring them. But you have a lot of resources that you can take along with you to help you. Okay, so we're done with sleep. We did the guidelines, we did the pharmacologic management. I want to go back quickly before I want to go back to the page we were on previously, medical issues and clinical care, and just show you our medical advisories real quick. I'm not going to go through all of them, and probably many of you have already heard me talk about, I always talk about the top two, um, which talk about antipsychotics as being a type of drug that should be used with great caution in our population and can cause um, some really difficult symptoms. And SSRIs can actually cause kind of the opposite of what you would intend for them. So that's what these two advisories talk about. I just want to show you that we do have a brand new advisory as of October 28th of this year. It was released on vaccinations. So this is new. I like to share new resources. And this basically says, I'll get you to the heart of the matter here. Um, The Medical Advisory Committee advises that families and their medical providers follow the American Academy of Pediatrics recommended child and adolescent immunization schedule. This includes immunizations for children under 18 years of age, and then it lists out a bunch of them. Vaccinations are a critical component of disease prevention and public health in alignment with the Center for Disease Control and Prevention, the World Health Organization, and other leading health authorities. We strongly recommend that eligible adults with Phelan-McDermid syndrome remain up to date with routine immunizations, including flu, COVID-19, shingles, pneumococcal, and Tdap. And then this part's very important. We encourage all individuals and families to consult with their healthcare providers as they make decisions around immunizations and to address any concerns they may have. So this is a medical advisory made in general for our population. It is not medical advice. You do not, this is one piece of information that you take with you and discuss with your child or adult medical professionals. Okay. Um, and if we go back, you can see there are a total of 7 medical advisories. So familiarize yourselves with these. You can bring them to appointments, whatever ones are relevant. All right. Excuse me. We talked about the pharmacological information. So I want to go back to the neuropsychiatric page and just give an overview. So we have in the past several years seen as our population gets older, that neuropsychiatric illness can be a part of Phelan-McDermid syndrome, especially in late teen, early adult years. It is very, very challenging part of Phelan-McDermid syndrome to manage, and it can be very, very hard for the individual, but also for the family. So we do have a lot of resources and support around neuropsychiatric episodes and illness. And this page outlines a lot of that information. We have a video explaining about neuropsychiatric illness and Phelan-McDermid syndrome. This is Dr. Alex Collison, who is on our medical advisory committee and also our neuropsychiatric consult group. He's the chair of that. And he discusses how these episodes can look in our population. So if your child's doctor is having a hard time understanding how treatment of neuropsychiatric illness may look different in Phelan-McDermid syndrome than in the general population, this is a great video to share. This talks about just descriptions of what the different types of symptoms and conditions can look like. So it can look different in our population because our kids aren't always able to articulate things so well. So, something like depression, you have to look at how they're behaving sometimes. It can come out as behaviors like they're moving slowly, may look sad, may be irritable, may look fearful. It would look different than if a neurotypical person was having depression. Or it could look different, I should say. So this just gives you some descriptions of those things. We talked about the pharmacologic management. So this is that flowchart page, all those pages. If your child or adult is dealing with these types of symptoms, we want you to know that we have a wonderful neuropsychiatric consultation group to support you. This group meets every 2 weeks, and what it provides is a free provider to provider service. So your child or adult's doctor would need to apply for a consultation by filling out this form and emailing it to our chief science officer. And all the instructions are on this page. I will share all these links in my follow-up email. Um, Once you submit the form, once the doctor submits the form, it's usually it's more than a 6 week wait right now. I'm not sure exactly the wait, but usually it's like 6 to 8 week wait. And again, they meet every other week. So they would meet, you would not attend this. This is not for parents and caregivers. It's a provider to provider. So your child's doctor, usually the psychiatrist, the person that would be prescribing the medications, they would meet with our neuropsychiatric consult group. Um, and it's a consultation where they can deepen their understanding of how to treat and care for your loved one. So it's a really, really great thing. And I would encourage you if you have a loved one dealing with any kind of psychiatric episodes in Phelan-McDermid syndrome to take advantage of this free service that we offer. Um, in addition, I mentioned that we have our genetic counseling referral program, right? We do have another referral program. These are free programs. It's our neuropsychiatric referral program. So if you email me, carla@pmsf.org, I would send you an intake form that you would fill out, and then you, the parent, guardian, caregiver, would meet with our consultant, who is Dr. Tazy Collenberg, who many of you are very familiar with Dr. Collenberg. She's done so much great work for us. We're so lucky to have, Dr. Collison, Dr. Collenberg, so many amazing medical professionals. But she will meet with you and have a consult and help you understand our resources and treatment options. It's not medical advice. She would not be your child's provider, but it is an opportunity to deepen your understanding and get some ideas. So that's a really helpful resource program that we offer. And then we do also have, like I mentioned, our caregiver support group specifically for neuropsychiatric illness, families dealing with that. So if you have any neuropsychiatric things going on with your child or adult with PMS, please email me and I'll get you set up with our programs. All right, gonna keep going. I want to show you real quick under care. We have recently published our list of clinics. So this is pretty exciting. We have medical professionals around the country who see individuals with Phelan-McDermid syndrome and have graciously agreed to have their um, information listed on our website. So if you scroll down, it's a growing list. We're adding to this list. Our hope is really to build out a referral network. It's going to take time to do that. But this is the first step. So we were really excited to get this published over the summer. So it's going to tell you the clinic, the name of the doctor, their area of specialty, how you get in touch with them. So rather than Googling them and going through the normal way, use the contact information we've listed. Um, it's going to tell you in some cases there'll be some specific instructions. Like this one says they're not accepting new patients over 18, or this one they're accepting new patients for neuroimmunology. Mention PMSF as the referral. So be sure you read the instructions. There might be some notes that would be helpful to you. Okay. So that's new as of 2020, summer of 2025. And then I have a couple more things, but we're getting close to time. So I'm going to show you how our search bar works. You know how a search bar works, right? But I want to show you a couple of things that anything on our website you can find on our search bar, but a couple things that I'll just show you as examples. So we have a few quick resource cards. So if I search quick resource card, see what comes up. And our search feature is nice because even though I didn't say quick resource cards, see this has an S in it, it still picks it up. It doesn't, you don't have to have an exact match. So it's pretty smart like that. So if I go to our quick resource cards, we have two quick resource cards. We have I'll send you the link here, this direct link. Here we go. Our PMS 101, so Phelan-McDermid Syndrome 101 card, which I have here. And this one is a simple way to introduce Phelan-McDermid syndrome to others. So it has a QR code that links to this link tree, which we can, adjust as we want. It gives an about Phelan-McDermid syndrome. It gives the two kind of most commonly used medical advisories, a link to join our membership, information about research. So it's all right there in your hand. And on the back, it has QR codes to those links as well. And then we have our neuropsychiatric card, which I have here. And this one is really intended if you're in a neuropsych emergency and you need to pull the resources up really quick. So it has talks about our NCG. It has the video from Dr. Collison, our pharmacologic recommendations, our medical advisories, the form to request a consult, and then it links to a conference video about neuropsychiatric issues. So all of that is right using these cards. It's right at your fingertips. I've used the PMS 101 card during my son's ER visits to pull information up on my phone, and it's very helpful. And you can also, showing this to the provider and they see something credible, even just pulling up the picture of it on your phone is really helpful. That you have the backing of PMSF's resources behind you, right? It can help you kind of advocate a little bit better. If you scroll down to the bottom, it shows you how you can get the printable cards. There's instructions for using Avery templates and other templates. And then also digital cards, you can download them and save them in your phone so you don't have to even have the paper copy. Okay, so those are there, really helpful. And then, let's see, a couple more things I want to be sure. Oh, I wanted to show you our search feature again. So another really exciting resource that was released in 2025. This is another new resource just last month, is our nutrition guidelines, which were written by Chardell Buchanan. With consultation with Kara Dubinsky. So I'll scroll down to show you their bios first so you can see who these ladies are if you don't know them. There's Chardell. She's a registered dietitian nutritionist, and she wrote the guidelines, and then she consulted with Kara Dubinsky, who is also an RDN, and also a CDN. So they work together on these guidelines, and we just recently published them. We did a pathway session, Chardell facilitated in November about the nutrition guidelines. So this is another resource that's available to you as you are making decisions about your child's care. If your child sees GI or has a nutritionist of their own, then you could bring these guidelines along, to discuss their diet, supplements, all of that. All of that's in here. So you can see the table of contents. There's vitamins and minerals, supplements, and then it talks about different common GI issues, maintaining a healthy weight, etc. So another super resource that's brand new. Okay, so I went through, let's see. I want to show you where all of our pathways sessions live. So that's kind of an important thing to know if you've been watching our pathways sessions this year. I'm going to use our search feature and just search for pathways. And here they are. This is our Pathways archive. So we've been doing one webinar per month. And all the session archives are down here. So there's November was nutrition and Phelan-McDermid syndrome. There's a link to the YouTube recordings. October was promoting overall health. September was coping strategies. We had state resources, handling denials, puberty, menstrual management, and women's health, medical advocacy and strategies, de-escalation strategies for crisis, and how to talk about Phelan-McDermid syndrome. So all of them have the recording and the slides and are available for you on this archives section. And that I'm going to then show you two places where you can access our YouTube channel. So one is if you go to the recordings of these sessions, it's going to bring you up to YouTube. This brings you up to my recording of my most recent pathways, but if you go to Phelan-McDermid Syndrome Foundation at the bottom, it's going to bring you to our YouTube channel that has all of our videos, all of PMSF's video resources. And if you go to our playlists, again, I'm going to send you a link to all of this, so don't worry about writing it down. If you go to our playlist, you're going to see here we have all of our 2025 Pathways Education Series webinar recordings archived in one place. So if I click on that, I'm going to get them all over here. Okay. And then if I go back, um, here's all of our 2024 Family Conference archives. So if you wanted to go back to this lens of sleep issues, you could go scroll down, and here's the session from 2024. Welcome, everybody. On sleep. And this is another resource that you can share. You could send the link to your child's medical professionals. You can watch it yourself and, take notes and make adjustments to your child's care based on what you learn. GI issues, nutrition, all of these different neuropsychiatric illness, these can all be used to complement the resources that I've shared with you already. There's a whole session on the U.S. International Clinical Care Guidelines. So we went through that 30-page document really quickly. If you want to learn more about it, dig into this session. There's an hour session that will help you understand the guidelines. Okay, so all of that is there on YouTube. Again, it's under our YouTube channel. That's the handle at PMSF 22Q13. And then there's different playlists down here. Okay. We'll have a whole other playlist this summer after the 2026 conference. So excited to be looking forward to that. Lastly, I want to quickly get into under our cure. We did connect. We spent a lot of time in care. And now we're going to just dive into cure. So I can show you a little bit of what we have under our science and research initiatives. If you are someone who wants to understand more about what studies are currently going on for Phelan-McDermid syndrome, we always have our family participation opportunities tab is always up to date. And you can click on participation in research to learn about studies. So studies would be where you're giving information, answering questions. The natural history study, you go into the site and they do different types of testing and psychological testing, and they might do a blood draw, that type of thing. So you're giving information and participating in research. A clinical trial is different. That's where it is a trial of, for us, right now we have therapeutic drug trials and gene therapy trials happening. So that is where there is some kind of intervention, a pharmacological intervention happening to your child. That is a different thing than a research study. Okay, so this one is going to show research studies. Get ready because there's a lot here right now. So if I scroll down, excuse me, to research studies, this was just updated about less than a month ago. So we update it every few weeks. So it's pretty up to date. And if you scroll down, these are all of these items in the large font in dark green, these are all the studies happening right now in Phelan-McDermid syndrome. It's a lot. There's lots of opportunities. So you can click on these and go through and read about the eligibility criteria. There'll be a contact information, and all of the information that you need should be listed. If you have questions about the studies, it's going to give you the contact information of the person to reach out to. Okay, so I'm still going. I'm still scrolling. There's a lot. If I go back up, let's see. Yeah. Okay. So it will probably be updated again soon, I would think. But we keep this pretty up to date. And then where was that? Family participation and research. So that was under here. And then clinical trials are listed here. Um, this gives you the information about which trials are currently enrolling. So as you can see, um, currently the trials that are enrolling for Phelan-McDermid syndrome are JAG 201, Jaguar gene therapy, and NNZ 2591. So those are both currently enrolling, currently recruiting people for the trials. We do not endorse these trials. We're not saying to go out and do this or encouraging you to participate in the trials. That's not the role of PMSF. Our role is to share information to help you make the best decision for your family. So you need to go through and look at everything and decide as a family, is this something that we would want to do? Okay. We provide as much information as we can. If you have questions about clinical trials, the most current information is going to be on clinicaltrials.gov. So you would go to clinicaltrials.gov and you would put in Phelan-McDermid syndrome and search, and it's going to show you everything that's. So right now it's showing you everything, but if I wanted to do what's recruiting, there's NND 2591. That's the Neurin trial. Oh, it's a therapeutic drug. And then Jaguar gene therapy. So that is a little bit of an overview of where you can find information about clinical trials and um, research studies. And then I think I've covered everything I had on my docket. So we're at an hour's time. Um, if you have questions about any of this, I want you to please feel free anytime to reach out to me. It's carla@pmsf.org. And I will share the recording and all of the links that I talked about in my follow-up email. Thank you so much for coming, and I hope you have a great day.